Hello, my name is Patrick Blevins, and I will be presenting on interleukin diseases and therapeutic uses. We're just going to go over and discuss a couple different diseases, uh, and then we'll go over a couple different therapeutic uses dealing with interleukins. But first, we're going to go over just a background and then a history of interleukins. Interleukin background. The interleukins are cytokines, small proteins involved in cell signaling, particularly in the immune and hematopoietic systems. They form by name a group of cytokines that are more essential importance for the functions of the immune system, both innate and adaptive. Interleukins are a family of proteins that were originally isolated from leukocytes, from which their names originate. It's now known that interleukins are produced by practically all cells types, including osteoclasts, osteoblasts, and even osteocytes. Interleukins are a soluble protein or peptide that exerts overlapping and antagonistic actions. As a family, interleukins are all involved in the regulation of cell activation, differentiation, proliferation, survival, as well as cell to cell communication. Interleukin history. In an early attempt to classify cytokines, immunologists began numbering them in order of their discovery and naming them interleukins. So, that being said, the first one they discovered would be interleukin 1 or IL-1. The name interleukin reflects the fact that they communicate between white blood cells or leukocytes. The first disease we're going to take a look at is rheumatoid arthritis. Rheumatoid arthritis is a chronic inflammatory disorder that can affect more than just your joints. An autoimmune disorder, rheumatoid arthritis, occurs when your immune system mistakenly attacks your own body's tissue. In some people, the condition can also damage a wide variety of the body systems. That includes like your skin, your eyes, your lungs, your heart, and even your blood vessels. Some of the signs and symptoms of rheumatoid arthritis can include tender, warm, or swollen joints, joint stiffness that is usually worse in the mornings or after uh, inactivity. Some more could be fatigue or fever and even weight loss. As rheumatoid arthritis progresses, symptoms usually spread to the wrists, knees, ankles, elbows, hips, and shoulders, so to most joints. In most cases, symptoms occur in the same joints on both sides of your body. In about 40% or about 40% of all people who have rheumatoid arthritis also experience signs and symptoms that don't involve joints. Rheumatoid arthritis actually can affect non-joint structures such as your skin, your eyes, your lung, your kidneys, your saliva glands, your nerve tissue, bone marrow, and blood vessels. The next disease we're going to take a look at is called NOMID, or neonatal onset multisystem inflammatory disease, and it's a disease that used to be around 20% fatal. The patients typically have a skin rash at birth or within the first few weeks after birth. Neonatal onset multisystem inflammatory disease, or NOMID, is a disorder that causes persistent inflammation and tissue damage, primarily affecting the nervous system, skin, and the joints. Recurrent episodes of mild fever may also occur in this disorder. The rash that's present when they're born will persist throughout life, but it can change from location and actually how much it covers of the body. Most of the time, infected individuals will have headaches, can have seizures, and that will can turn in cause vomiting, and the vomiting resulting from chronic meningitis, which is inflammation of the tissue that covers and protects the brain and spinal cord. Intellectual disability may occur in some people with this disorder. There has been cases of hearing and vision problems from nerve damage from the inflammation in the various tissues of the eye. People with Nomen experience joint inflammation, swelling, and cartilage overgrowth, causing characteristic prominent knees or other skeletal abnormalities that worsen over time. A lot of times they have joint deformities. Those are called contractures, and they may restrict the movement of certain joints. So they can be debilitating or even limit them from being able to move those joints. Other features of this disorder could include the patient having of short stature and having shortened or lowering legs and shortened forearms. They also sometimes have characteristic facial features such as prominent forehead and protruding eyes. Abnormal deposits of a protein called amyloid may cause progressive kidney damage as well. Luckily, there have been some therapies that have been researched and found to work for both of these diseases. Interleukin therapies. Over the last few decades, there have been many studies conducted on the use of interleukins as different therapies. They have found that a great deal of these tests have been successful. I'll give you a brief overview on the few that I researched. IL-1 is used to fight rheumatological diseases. IL-1 is a pro-inflammatory molecule playing a critical role in broadening list of diseases. And it actually plays a role in the two diseases that we just spoke of. IL-1 neutralization is effective against rheumatological, autoinflammatory, and inflammatory diseases such as cardiovascular diseases and diabetes. In patients with rheumatological conditions, IL-1 inhibition may provide clinical benefits beyond the efficacy of on osteoarticular manifestations. So IL-1 uh, has been being used to help fight rheumatoid arthritis as well as Nomen. Autoinflammatory syndromes differ from autoimmune diseases in that pathogenesis does not revolve around recognition of self-antigens by dysfunctional T lymphocytes or autoantibodies. Rather, the hallmark of all autoinflammatory syndromes is uncontrolled monocyte macrophage-driven inflammation. Monocytes from patients with autoinflammatory diseases release more IL-1s but not enough TNFs compared with a healthy person. Currently, anakinra is the approved treatment for RA or for rheumatoid arthritis as well as for Nomen. Um, some of the best treatments found to help many of the patients of Nomen's and RA have been the use of various interleukin 1 blocking or trapping or otherwise attacking drugs to prevent cellular uptake of interleukin 1 B in CAPS patients. Often with these uh, therapies, dramatic improvement is seen within days to weeks of starting these medications. In the U.S., anakinra is the only medication that is FDA approved for NOMID patients. So they've seen great success using these therapies in uh, the use in the diseases of RA and in NOMID. Here are the references that I have for that I use for this presentation. And Dr. Blair, I'm fine with you uploading these and using these however you need. Thank you.